Now, doctor, obviously being an athlete, you're putting your body at great risk for injuries. Can you maybe mention some of the sports of the athletes that you have treated?
Yes. I've treated everyone from world-class judo competitors to professional hockey players to intercollegiate athletes playing football, basketball, baseball, hockey, tennis, golf, track and field runners, weightlifters, strongmen. Virtually any sport in where you have an injury that's lagging on, that's not healing, can be treated with prolotherapy. And I also want to add, acute injuries can also be aided in the healing, to heal faster by using prolotherapy as part of the treatment plan, along with a good physical therapy program.
Doctor, obviously being an athlete, you're putting your body at great risk. Can you mention some of the sports that you have treated athletes with prolotherapy?
Certainly. I've treated people in virtually every sport that's played. Most commonly, soccer players with groin pulls, hockey, basketball, baseball, tennis, football, world-class judo, weightlifting, golf. I had a professional golfer come to me just the other week, and I was able to solve his problem with prolotherapy.
Well, you mentioned many sports right there. If an athlete is having an issue recovering from an injury and surgery is in the near future, is prolotherapy a better option for them?
Yes. Prolotherapy is an excellent alternative to surgery. Sometimes surgery is required for very serious injuries, but other times it's optional. In the case of prolotherapy, prolotherapy is very effective for anterior shoulder dislocations, rotator cuff tears, chronic elbow pain due to tennis elbow, plantar fasciitis, in which you would try to avoid surgery as much as possible. Prolotherapy can be used to treat these injuries, avoid the surgery, and avoid the lengthy recovery time and rehabilitation that's required after surgery.
Now, I'm not a professional athlete myself, but I do have issues with my lower back that have been ailing me for years. Would I maybe be a good candidate for prolotherapy?
Yes, Ashley. Prolotherapy is an excellent treatment for lower back pain. If you have point tenderness in your lower back, if you're having difficulty getting up out of a chair in the morning, difficulty standing for long periods of time, this may be due to sacroiliac instability, which is a very common and very overlooked cause of lower back pain. I have treated literally hundreds of people that have had this condition, and over 80 to 90% of them have successfully had their back pain go away.
Doctor, what are the basic causes of joint pain and how can prolotherapy treat them?
The basic causes of joint pain are actually due to instability of the joint. If we injure our bodies when we're young, and we injure a ligament that has not healed properly, the joint doesn't work properly. The alignment is out. Also, as we get older, the ligaments that hold the joint together thin out, become weak, and sometimes tear. Again, this causes the joint to not work properly. With prolotherapy, you actually cause the ligaments to be repaired. You tighten the joint so that it operates properly and the pain goes away.